Hi dear students. To begin with the cholinergic drugs. So the cholinergic drugs, they are divided into directly acting and the indirectly acting drugs. So what are these cholinergic drugs? They are the ones which mimics the action of acetylcholine in the body. Okay, so as I told you, we have directly acting and indirectly acting cholinergic drugs. So what do you mean by this directly acting? Directly acting cholinergic drugs, or we call it as directly acting cholinergic agonist also, which acts directly through the muscarinic and nicotinic receptors in our body. So they are classified into esters and alkaloids. It is acetylcholine, carbachol, bethanacol. These are the esters, and the alkaloids are pilocarpine, muscarin, and ericoline. Indirectly acting cholinergic drugs or indirectly acting cholinergic agonist. They are also called as anticholinesterases. So from the name itself, you will come to know what they are. They act by inhibiting the cholinesterase enzyme, which hydrolyzes the acetylcholine. So by inhibiting that cholinesterase enzyme, it increases the level of acetylcholine in our body. So they are classified into reversible and irreversible. Reversible one, that is carbamates and non-carbamates. Carbamates we have physostigmine, neostigmine, pyridostigmine and rivastigmine. Non-carbamates are edrophonium, tatrine, galantamine, donepezil. Irreversible ones, that is organophosphates we have, that is diphenolase, ecothiophate, parathione, malathione, and the carbamates are carbaryl and propoxyl. We have the nerve gas poisons also, which comes under the irreversible one, that is sarin, soban, tabun, diazinon. They all come under the nerve gas poison. So this is how the cholinergic drugs are classified. In this video, I'll be mainly dealing with the pharmacological actions of the acetylcholine. So about the cholinergic drugs, I'll explain in the next video. So coming to the pharmacological actions of the acetylcholine. So as I told you, these drugs, the directly acting and the indirectly acting ones, they mimic the action of the acetylcholine in the body. So their actions are all similar to that of the act. I told you directly or indirectly. So these pharmacological actions which are mediated through the muscarinic or nicotinic receptors. So based on the receptor through which acts muscarinic or nicotinic, the pharmacological actions has also been divided based on the which receptor through which it acts. Okay, so in the heart, what it does is actions are muscarinic, which has been mediated through the M2. Okay, M2 receptor mediated. You already have come across the videos like which are the different cholinergic receptors subtypes. Okay, muscarinic, which are the subtypes, which are the nicotinic receptor subtype. Yes, so here in the heart, M2 receptors are present. So cardiovascular actions of these cholinergic drugs or the cholinomimetics are mediated through the M2 receptor present in the heart. So it terminates in this postganglionic fibers, it terminates in SA node, atria and the AV node, and it causes the hyperpolarization of the SA nodal cells and decreases the diastolic depolarization. And it depresses the SA node, decreases the contractility of the heart. So it has got a negative chronotropic effect and negative inotropic effect. So it even decreases the impulse generation and which can lead to decrease in the heart rate, bradycardia, decrease in the force of contraction, cardiac output, and it increases the PR interval. As a result, it can lead to partial to complete heart block and even cardiac arrest can happen. So these are all the actions of acetylcholine on even the cholinomimetics mediated through this M2 muscarinic M2 receptors which is present in the heart. Okay, so next in the blood vessels. In the blood vessels, the receptors are M3. M3 receptors are present in the blood vessels. So it relaxes the vascular smooth muscle. It dilates the blood vessels, especially in the face and the neck, which can lead to flushing, because over the face or the blood vessels will be dilated, which can lead to blushing, that flushing, and even the hypotension. Okay, and indirect, this is an indirect action which has been mediated. There is an indirect action. This is the direct action which has been mediated through the M3 receptors, and the indirect action is by the release of the EDR. What is EDR? Endothelium derived dependent the relaxing factor. Okay, endothelium dependent relaxing factor. So the pharmacological actions of the acetylcholine through the blood vessels. So through the blood vessel, the vasodilatation that has been released, or I told the endothelium dependent relaxing factor. So what is happening here is, when there is activation of this IP3-DAG pathway, it acts on this calcium calmodulin mechanism. So when there is this mechanism, it gets activated, there will be this nitric oxide synthetase enzyme gets activated, which leads to the formation of the nitric oxide in the endothelial cell. So what happens is, this nitric oxide which has been in the endothelial cells, what has been formed in the endothelial cell, nitric oxide is a potent vasodilator. So from this endothelial cell, it diffused into the vascular, that smooth muscle, okay, vascular smooth muscle, where it activates the guanyl cyclase. Okay, so this guanyl cyclase gets activated, which leads to the formation of the cyclic GMP. This cyclic GMP then activates the protein kinase G. Okay, and this leads to the dephosphorylation of the myosin light chain kinase. So what happens? There will be a decreased availability of the phosphorylated myosin light chain kinase, which can lead to the muscle relaxation. So vascular smooth muscle relaxation, it happens. So this is another mechanism where the decrease in the calcium, availability of the calcium also decreases. Okay, because again it's because of this calcium calmodulin mechanism, there will be inhibition of this calcium channel. So availability of calcium decreases. So activation of calcium calmodulin mechanism gets affected, which also can lead to the relaxation of the muscle. So that's how it produces vasodilatation in the smooth muscles, vascular smooth muscles. So in the glands, it is mediated through the M2 and M3. So it enhances the secretion of all the glands. All the gland secretion will increases, which can lead to increased sweating, salivation, lacrimal secretion will increases, GI secretion will increases, tracheobronchial respiratory secretions will increases. Okay, so all these actions are mediated through M2 and M3. Next, in the smooth muscles, which is being mediated through M3. You know that in the blood vessel also same, right? So in the urinary bladder, the detrusor muscle contracts, whereas the trigone and the sphincter relaxes, which lead to the voiding of the bladder. Okay, and in the bronchi muscles, there will be bronchoconstriction, dyspnea, and there will be attack of bronchial asthma. So the bronchi will be constricted, and as I told you, all the gland secretion will increase. So the tracheobronchial, all this respiratory secretion also will increases, which can lead to severe attack of the asthma and dyspnea. Smooth muscles, even in the gallbladder and the ureter also, there will be, it contracts the smooth muscles. Then in the GI tract, M1 receptor is also present. So M1 and M3 mediated, what are the actions in the GI? It is mediated through M1 and M3. So all the secretions of the glands will increase in the tone and peristalsis, which can lead to the evacuation of the bowel. Okay, tone and peristalsis will be increased, which can lead to the evacuation of the bowel. Next, in the eye. In the eye, the contraction of the circular muscle of the iris. It is mediated through the M3 receptors, which lead to the constriction of the pupil. Okay, that is what we call it as the miosis. So, which is even the contraction of the ciliary muscle, that can lead to the spasm of accommodation. So, because ciliary muscle has got the parasympathetic innervation. And another action is increases the outflow fluidity. Aqueous humor outflow is being increased. So this can even lead to the intraocular tension, especially in the patients who are having glaucoma. So it will be beneficial also, beneficial in patients who are having glaucoma, since it decreases the intraocular tension by increasing the outflow of the aqueous humor. So this is what I told in the normal eye, okay, and this is the effect of a mimetic or even the anticholinergic, directly acting, indirectly acting. It can produces myosis, the size of the pupil it decreases. So it's because of the contraction of the sphincter pupillae or the circular muscle of the iris. So this is just a summary of the different actions of the parasympathetic nervous system, or the cholinergic agonist, how they act in the eye. It causes constriction of the pupil, myosis. Lungs, there will be bronchoconstriction, increase in the secretion. Heart, it has got a depressant effect, decrease in the heart rate. Okay, contractility, automaticity decreases. Okay, in the blood vessel there will be dilatation. The GI, increase in the tone and peristalsis. Secretions will increases. Urinary bladder, it helps in the voiding of the bladder. Yes, bladder contracts. Salivary gland also increase in the salivary secretion. Just a summary. And coming to the nicotinic actions, so till now we were discussing about the muscarinic actions, all the muscarinic actions which is being mediated to different muscarinic receptors. And nicotinic receptors, mainly two types are, that is the NN and NM, right? So NN, which is present in the autonomic ganglia. So here both the sympathetic and parasympathetic ganglia are stimulated by the through these NN receptors. Then in the skeletal muscle, there will be contraction of the fibers, that is this NM receptors, where it is present, it is in the neuromuscular junction in the skeletal muscle. So high dose, it can causes twitching and fasciculations. Okay, so these are all the nicotinic actions. And in the central nervous system, we have both muscarinic and nicotinic. So there will be a stimulation of the central nervous system followed by depression, and acetylcholine, as it does not cross the blood-brain barrier, no significant action on the brain. So these are the references for the different images and even for the further reading. Okay, so thank you students, happy learning.